We're making this video to go over the sympathetic and parasympathetic and map the nervous system as a whole. Whether you're EMT, advanced EMT, paramedic, or even a nursing student, you need to understand the sympathetic and parasympathetic. A lot of our patients' signs and symptoms and vitals are directly related to both of these systems, and not to mention most of the medications we administer are manipulating these systems to make the body do what we want it to do. So let's go through the nervous system. The nervous system as a whole is broken into two categories. You have the central nervous system, which is really just the brain and the spinal cord. Now, all of the nerves that are either feeding to the spinal cord or walking away from the spinal cord are part of your peripheral nervous system. Now think about all the signals your brain is receiving and sending, from voluntary movement like your arms and your legs to involuntary things like digestion or the size of your blood vessels. Those are all part of the peripheral nervous system, and it's broken into two branches. You have the autonomic and you have the somatic. Now, the somatic nervous system is just your voluntary movement. Arms, legs, muscles. Anytime you think about moving, you're actually just using the somatic nervous system. The autonomic nervous system is all the things that are going on that you have no conscious control over. Like we said before, digestion, bronchial dilation, the blood vessels constricting or dilating. Now, the autonomic nervous system is broken into two categories itself, and those are the stars of the show and the main reason for the video, and that's going to be the sympathetic and the parasympathetic nervous system. Now, the parasympathetic nervous system is known as the rest or digest, or it used to be known as the feed or breed, but we know when the parasympathetic is stimulated, we get a decrease in heart rate, which leads to a decrease in blood pressure. The sympathetic nervous system is known as the fight or flight system, and when it's stimulated, we get an increase in heart rate, an increase in BP, and we also get an increase in oxygen because we got bronchial dilation, which allows more oxygen to get on board. Now, a lot of students get lost in this misconception that there's some kind of switch and the patient's either in sympathetic mode or parasympathetic mode, but it's not really accurate. A more accurate way to visualize it is to think of a balance. Now, under normal states, if you're not extremely tired or digesting a large meal, you should have a good equal balance between sympathetic and parasympathetic. And if you eat a large meal and your body's trying to digest that meal, you might start to get a little bit more parasympathetic tone, which causes that balance to tip this way, which causes the decrease in heart rate and the decrease in blood pressure. But if somebody barges in your house with a gun or a knife, your brain's going to recognize that as a threat, and it's going to say, hey, I got to fight my way out of here, or I got to flee. But either way, my muscles are going to need some energy. They're going to need some oxygen. So the body starts to turn up the sympathetic tone, and that causes the scale to tip this way. That increases the heart rate to move that blood around faster. It increases the blood pressure to push the oxygen into the muscles, and it dilates the lungs so that I can breathe in more oxygen with each breath. Now, the sympathetic nervous system works on 3 receptor sites. Well, 3 that we're going to talk about in this video. There's actually more, but these are the 3 you really need to know for National Registry. You have alpha 1, beta 1, and beta 2. Now, receptor sites, you can think of them kind of like electrical sockets, and they are designed for certain chemicals. And for this video, we're going to use epinephrine as an example because it works on all 3 of them. Whenever epinephrine binds with one of these receptor sites, it triggers a response. Now, the alpha 1 receptor sites are located in the arteries. The beta 1 receptor sites are located in the heart, and the beta 2 receptor sites are located in the lungs. So, when we bind to an alpha 1 receptor site, since it's located in the artery, it causes arterial constriction. We know that beta 1 receptor sites are located in the heart, so when epinephrine binds with beta 1 receptor sites, you get an increase in heart rate. And when it binds with beta 2 receptor sites, you get bronchial dilation, so you can get more oxygen on board. Now, a lot of students mix these up, so I got a little memory aid to help you guys. The alpha 1 receptor sites located in the arteries. A for arteries. The beta 1 receptor sites are located in the heart, so I think of beating, like a beating heart. That's what the B stands for. And 1, I have one heart. Beta 2 receptor sites located in the lungs, I think of breathing. And I have 2 lungs. That's it. The nervous system, the sympathetic, the parasympathetic, mapping of the nervous system. If this video helped you at all, please like and subscribe. I know it's cliche, but it really helps the channel with the algorithm. And if you have any other topics you want us to cover, leave it in the comments. Until then, stay safe.
The more I know, the more I worry, the more I worry, the less I sleep, the more I read, the more